Hey everybody, Dr. Ballum here at Legacy Chiropractic, and I wanted to take a minute to address a question that I get asked on a pretty frequent basis. The question is, should I be adjusting myself? And boy, let me tell you, I wish the answer was yes, because there were so many times I wish that I could have been my own chiropractor and fixed the problem I had going on, but it's just not possible. And I also know that it's not safe either. So I want to address those 2 points here in the video so you understand what's going on. So first of all, trying to adjust yourself is not a safe option to try and do. The reason is you can't identify specifically which bone needs to move, and when you try to push and twist and do that sort of thing and you're hearing things pop and click and move, you have no idea which bone is moving, which direction it's moving, if it even moved in the right direction at all. And so you could quickly get yourself into a tough spot where a small problem becomes rapidly worse. And so that's why I wouldn't recommend it. The other thing too is when you're trying to pop your own neck, for instance, what's happening is you're popping or you're moving parts of your spine that are compensating for the problem. So let me show you. If you had two bones like this and they weren't moving effectively, they were kind of stuck, the bones around that stuck joint are going to have to move, become more flexible to compensate. So every time that you're doing this and popping or cracking your neck, you're essentially allowing those compensation areas to become hypermobile. They're able to move too freely. Meanwhile, that stuck, restricted joint is only becoming more stuck, more restricted as the rest of your spine is becoming more and more hypermobile. There's an even greater difference between the lack of movement and too much movement, and then that can create a whole host of different kinds of problems as well. Another reason it's difficult for you to adjust yourself is just due to the laws of physics. Let me show you. For instance, imagine if I was standing here and I was going to try to pick myself up off the ground. You could see, like, no matter how hard I try, no matter how hard you try from home, trying to pick yourself up off the ground, it's not possible. And so if somebody came and picked me up, they were stabilizing themselves on the ground and picking themselves up, or picking myself up, then that would work, obviously. And the reason for that is they have stabilizing on the ground. And when I do an adjustment on a patient, most people think the most important part of the actual adjustment is the hand that is pushing the bone. But what they fail to recognize is that the other most important part, maybe even the most important part of the adjustment, is what's stabilizing the rest of the spine, so that when that correction happens, all of that input, all of that force goes directly into that one bone. And so that's the most important piece. And when you try to do this, you have nothing to stabilize, no force outside of your body to help aid with that correction. And so that is my reason why you should not be trying to adjust yourself. It's not safe, but also it's just not possible. So stop trying, but listen to your body. If you do feel that need, like something feels off and you feel that need, like you need to pop your neck or you need to pop that hip, that is your body's innate response telling you something isn't lining up right. And that's a good indicator telling you that you should pay your chiropractor a visit. And the patients I see in the office, they find that pretty quickly over time, as they are getting the care that they need, those restricted joints are healing and getting better. That need, that sensation to have to auto-correct or try and self-adjust their spine, they don't feel like they need to anymore because they are getting true correction. So again, I'm Dr. Ballum here at Legacy Chiropractic, and I've got your back.